Retention of placenta, that is ROP, is observed more frequently in bovines than in other animals. In gravid uterus, fetus is attached to uterine wall through fetal membrane. The attachment site of fetal membrane and uterus is known as placentome. Maternal part of placentome is called caruncle and fetal part of placentome is called cotyledon. There are 100 to 125 such attachments in bovines. These attachments help in transportation of nutrients from mother to fetus. Fetus grow and develop very rapidly inside the uterus. On the completion of gestation period, parturition happens, and in normal condition, within 6 to 24 hours after parturition, placenta comes out. Complete removal of placenta is important. Any remnant part due to non-detachment of cotyledon and caruncle could result in infection. The retained fetal membrane is termed as retention of placenta, that is ROP. Reasons behind retained placenta are poor uterine muscular contractibility, inflamed and edematous placentome. The retained placenta hangs out of vulva, which comes into contact with dirt, dung, and mud, which may lead to uterine infection. Thus, retention of placenta makes animal more prone to metritis, endometritis, and pyrometra, which hinders animals' reproductive performance. The present available options for treating ROP are hormonal therapy, manual removal, etc. But these available options do not help in comprehensive detachment of placenta. As hormonal treatment only enhances uterine constriction, but they do not minimize the inflammation and edema of cotyledons, thus complete detachment is not possible, and in most of the cases, manual detachment is required. Whereas, manual removal is not advocated because it may lead to uterine trauma, hemorrhage, infection, and there is every possibility that some part remains left inside the uterus. Due to this reason, after manual removal of placenta, some preparations are inserted inside uterus to dissolve the remnants of placenta. Over and above to this, manual removal involves lots and lots of effort. So we need a comprehensive solution of ROP treatment which involves less manual interventions. At the same time, it should offer advantage of effortless removal of placenta. Intas is introducing for the first time in India for comprehensive and effortless treatment of ROP. Ropitas, an herbal intrauterine bolus. Ropitas works on the root cause of ROP and gives magical result. Ropitas helps in complete detachment of placenta. As Ropitas is dispersed quickly in uterus and it reduces the size of cotyledon and caruncle and increases uterine contractibility. Over and above the detachment of placentome, Ropitas also acts as antiseptic, analgesic, and sedative. Ropitas is a power-packed combination of 5 potent herbs which play a vital role in treatment of ROP. Herbs such as Quercus infectoria, Mentha piperita, Tuncan sour, and Curcuma longa reduce inflammation and edema by constricting blood vessels of placentome. Tuncan sour and Cisamplos parira present in Ropitas help in increased uterine constriction. Herbs such as Curcuma longa and Tuncan sour act as antiseptic and antibacterial. Benefits of Ropitas in the treatment of ROP are: Ropitas helps in easy expulsion of placenta without much manual intervention. Ropitas offers comprehensive solution. Ropitas alone is sufficient. Ropitas is available in strip of 4 Boli with full-length hand gloves. Ropitas should be administered as intrauterine. Ropitas is an expert in the management of ROP.